The man on the hospital bed is dying. He's sweating, shaking. His organs are starting to fail. He just flew into Lagos from Liberia and now he's crashing fast. Doctors think it's malaria or is it typhoid? Maybe both. But one woman, she's not buying it. Dr. Stella Adadevoh, endocrinologist, respected, precise, calm, under pressure. She takes one look at his symptoms. Everything in her gut is saying, this is Ebola. She orders isolation, quarantine. The patient fights back. He says he's fine. He wants to leave right now. Then his embassy calls the hospital. They want him out now. But Stella, she doesn't flinch. She says no. And that decision, that single act of defiance, it saved Nigeria from a catastrophe because she was right. The patient was Patrick Sawyer and he did have Ebola. This was July 2014. At the time, over 600 people had already died in Guinea, Liberia, and Sierra Leone, and the numbers were rising fast. By the end of that outbreak, by the end of this Ebola outbreak, that death toll will go past 11,000. Now, Ebola had just walked into Lagos, one of the most crowded cities in the world. But thanks to Dr. Stella, it did not spread. Let's pause. Who was this woman? Why did she have to be the one to make this decision? Dr. Ameyo Stella Adadevoh. She was more than just a doctor. She came from a long line of Nigerian legends. Her great grandfather, Herbert Macaulay, one of the fathers of Nigerian nationalism. Her grand uncle, Nnamdi Azikiwe, the first president of Nigeria. She grew up in Lagos. She studied medicine at the University of Lagos. She trained at Luth and later she specialized in the UK. She wasn't a government official. She wasn't in public health. She was a private hospital doctor at First Consultant Medical Center in Obalende. She was not supposed to be the one who stopped an epidemic, but she did. When Patrick Sawyer came in, nobody suspected anything major. He said, well, he thought he had malaria, but Dr. Stella noticed strange symptoms, unexplained bleeding, red eyes, fatigue that didn't make sense. She did a bit of research on her own. She looked up the CDC guidelines for Ebola. She acted fast. She alerted the Nigerian Ministry of Health. She wrote to the government. She raised the alarm. This woman was not silent. She was doing everything that she could as one woman. She kept him locked down, even though it brought massive pressure on the hospital. People told her, let him go now. He wants to go. His embassy has called. They said she didn't have proof that he had Ebola. Some even said she was being too dramatic. But she held her ground. She did not just quarantine him. She began contact tracing. She made sure that the staff had basic protective gear. They were using trash bags, plastic face shields, anything that they could find. She was buying time. She was trying to contain this virus until the government could catch up. And it worked. Thanks to her quick action, Nigeria traced 529 people who came into contact with Sawyer. 20 people were infected. 8 of those people unfortunately died. Let me put that into perspective for you. Liberia, over 4,000 deaths. Sierra Leone, nearly 4,000. Guinea, 2.5. Nigeria, 8. Because of Stella Adadevoh, but the cost was unbearable. Dr. Stella got infected. Despite all her precautions, the virus got through. She kept working until she physically couldn't anymore. She was isolated, treated by her own colleagues, and as her condition worsened, she never broke down. She stayed strong. On August 19, 2014, she died quietly in the same hospital where she had worked for over 20 years. She left behind a husband and a son. Nigeria mourned, but not enough. For years, no national honor was given, no state funeral, no monument. Her family created the Drasa Health Trust in her name, an organization that trains health workers, teaches infection control, promotes hygiene in schools, stuff like that. Eventually, in 2022, 8 years later, she was posthumously awarded the Officer of the Order of the Niger. If Dr. Stella had not stood her ground, if she had let Patrick Sawyer leave that hospital, Nigeria would have become another West African epicenter. It would have been terrible. Lagos could have lost millions. But she said no. She said we have a responsibility to protect the public, and she meant it. She didn't carry a gun. She didn't shout or march, but she fought and she won with calm, with courage, and with her life. Dr. Stella Adadevoh, true hero, never forgotten. Thank you so much for watching this video. This is a new thing I'm doing. I have a true crime channel, but this is a channel for heroes. So if you like stories like this, please follow me here as well. Thank you.